Hello, welcome to the Cowtown webinar series brought to you by Baylor Scott and White All Saints Medical Center in Fort Worth, Texas. We are getting ready for the February 25th through 27th Cowtown Marathon events, and registration is open for the 2022 year. Tonight, we're going to talk about injury prevention with Dr. Andrew Lee. I'm going to turn it over to him as we get started, and thank you so much for being with us.
Okay, thank you, Heidi. Let me see here. Okay, I'm Dr. Andrew Lee. I'm with the Bone and Joint Clinic here in Fort Worth, and I'm going to be talking to y'all about injury prevention for the upcoming marathon here in February. This is a good time to start talking about it, so we have a plan for it months in advance. So just going over some key points that we're going to want to discuss and focus on throughout the PowerPoint. So having a plan and a training program is extremely important in decreasing your risk for injuries. With that plan, you want to make sure that you start low mileage and go slow and progress your mileage slowly. Make sure that you have proper shoe wear and make sure that your shoes are changed at the appropriate times throughout your course training. Make sure that you're maintaining your hydration and nutrition and not trying to do a weight loss diet while you're doing training for your marathon also. And then knowing the difference between if you're hurt or injured. And sometimes when you're hurt, you can modify your plan or modify your running, the way you're running, versus if you're injured, you probably need to stop running and seek help. So first things is having a plan. This can be a huge difference in getting through your training program and getting through your race safely and being able to increase mileage effectively and get to that goal pace that you want. One resource that I like is runnersworld.com. The reason I like this is they have multiple different options for different pace goals. So you can Google and find different running strategies or different plans on the internet, but this has a lot of different options for different paces, which if you're someone who's run a marathon before, this may help you get to a new pace, to a higher personal best record. And inside of whatever plan you choose, you want to make sure that the plan is planning for you to avoid injuries. So cross training and rest are really important parts of any plan. You don't want to be running every single day. And then inside of every plan, whether it says to or not, you should be doing dynamic stretching before and after every run. And even on your rest days, it can be helpful to do dynamic stretching. This was just a plan that I've used in the past that was helpful for me. And I think it's good because it includes both cross training and race days. It can also change up the pace that you run. This one works for some people, but like I said, everyone has kind of a different style and you can look through the different ones. You just want to make sure that they include that cross training and rest day. Another important part of training is hills. For us, whenever we see someone who comes in and they start out right away just getting after hill training, a lot of times that will cause injuries, and the most common things that causes is shin splints. So hill training is very important. Every marathon to some degree, even if it's a flat marathon, will have some amount of hills. And so it is an important part of your training, but maybe just not week one. So as the course demands it, increase that hill training as you go, but try to do it a little bit later in once you've gotten some endurance going, because you don't want to increase your risk for stress fractures or shin splints. So start low and go slow. You want to make sure that training program has that ability to slowly increase its mileage. And if you're hurting, it's okay to rest. There's nothing wrong with resting. It's okay to slow your pace down, slow your mileage down, and then get back on your training program once you've had time to recover. So another thing that's very important is your shoes. So everybody has a favorite pair of shoes, and I've done this too, where you've had them forever and they feel great. But the problem is, even though they feel good, you will lose shock absorption after a certain period of time. So for shoes, that's about every 200 to 500 miles. So why that's really important if you're training for a marathon or a half marathon is that many training programs are going to go well over 250 miles. So for the average marathon mileage plan, for a 24-week plan is about 650 miles. For a 16-week plan, it's about 450 miles. For a half marathon plan, that's about 250 miles for a 16-week plan. So regardless of what you're running and what plan you're using, you likely are going to need to have a new pair of shoes somewhere in the course of your training. So you just want to time this correctly. You don't want to end up in a situation where the week before your marathon, you need a new pair of shoes, because breaking in a new pair of shoes 1 week before can be difficult. So keep that in mind as you are training, regardless of what your distance is. So what's the problem with losing shock absorption? So if your shoes don't have any shock absorption in them, you can increase your risk for a stress fracture. The main one we hear about or worry about is your tibia stress fracture. Someone going from having shin splints and progressing and pushing through and having poor shoes, and it goes on to a stress fracture. The other one are the small bones in your feet. I actually had this where I had a sesamoid fracture in my foot because I had an old pair of shoes that I really liked, but they probably should have been changed earlier. They also can increase your risk for plantar fasciitis and then those muscle strains. Another thing to keep in mind and to be very diligent about is hydration. Everybody knows that hydration is important, but it's really important that it's not just water. It's not just about drinking a bunch of water. It's more about getting your electrolyte balance with your water. So you need both sodium and glucose to retain water in your body. So remember that as you're doing these long runs, you may notice that you have some salt buildup on your face or on your body, and that's because you're losing these salts out of your body when you go on these long runs. So having some way to restore those salts and sugars with the water you drink is going to be key to keeping your muscles hydrated. So oral rehydration solutions are commercially available and they're very good. The only downside is they're not very tasty. So a lot of times sport drinks, a lot of people say negative things about sports drinks, and they probably are right, but they're not perfect, but they're better than just drinking free water. So if you can't stand the oral rehydration solutions, it's okay to have a Gatorade every now and then instead. It's not perfect, but it does do the job of restoring your electrolytes. And that is very important to keep your muscles activated and keep them going without getting an inflammation in the muscle or the tendon. Final thing about diet is this is probably not the best time to go on a weight loss diet. You want to keep your muscles strong and healthy and keep your body healthy. You're putting it through a lot of strain going on long runs. You want to make sure it has the energy it needs to recover from those runs. So hitting it with a second hit of a weight loss diet may not be the right time. If you do find yourself in a situation where you notice that you are getting strains and cramping and tendonitis in your legs after runs, dehydration is something you're going to want to incorporate into your treatment algorithm to make sure that this is not causing your problem. You may need to rest or slow your pace and focus on that nutrition and hydration as you go, and always add in stretching. Anytime you have a problem with dehydration or nutrition, you're going to have to probably stretch more to give your muscles a little bit more time to recover and to be prepared for your runs so that you don't go on to have a situation where you can't continue. The next thing is figuring out, am I hurt? And I can modify my activities and modify the way I run, or am I injured and I need to stop? This is probably the most important thing, and the thing that it helps whenever we see someone in clinic identify the difference between these two. So most commonly, the thing we see are soft tissue injuries such as hamstring or quad strains, Achilles or calf strains, shin splints, and plantar fasciitis. So these things, generally speaking, we can make modifications to the training regimen and the training schedule, and we can get this in tune and improve these before the race day and not lose a significant amount on mileage or pace. In contrast, whenever we see things like tibial stress fractures, metatarsal fractures, or sesamoid fractures, this is going to be difficult to recover from during this race. We want to make sure we're thinking long-term and knowing we're thinking about the race next time. So if we have a stress fracture, we can stop that from going on to a complete fracture and make it to where we can race another day. But identifying that early is important. So if you are struggling from muscle strains or tendonitis, dynamic stretching is key. Make sure you do that before your warm-ups and your cool downs. You may even need to incorporate that in the middle of a run. Maintaining hydration along the way and make sure you add those electrolytes in as you go is important to keep from making this worse. And then add in rest. It's okay to stop, rest. It's okay to add in a rest day. It's okay to slow down your average mile and pace. All those things are okay. Pushing through may delay your recovery. So if this is week 3 of your training program and you notice that you're having tendonitis or a muscle strain, you really probably should slow down and improve your stretching, improve your hydration, and stay focused on that timing of when your race day is. If you have 20 weeks to when your race day is, you have plenty of time to recover and to improve your mileage and your pace later after you recover from this injury. But a lot of times modifying your schedule and modifying your rest days can resolve this problem. The biggest thing and the most common thing that we see people come in for in regard to long distance running is shin splints and stress fractures, or the worry or concern for stress fractures. This is an x-ray on the left of what we call the dreaded line. So this is a line of a beginning of a fracture on the front of the shin. Generally speaking, you will have point tenderness here, and we will get an x-ray to look specifically for this before it progresses. Whereas shin splints, they tend to have an area of pain that's noted on this picture here over the entirety of the muscle, where it's circled there either on the back or the front of the thigh of the leg. So just to go over again, the difference between a stress fracture and a shin splint, if you're trying to identify this before knowing if you should come in or not, a stress fracture is generally point tender at one spot on the front of your shin, and it's normally in the mid portion of your shin. Whereas shin splints are going to be painful throughout the entirety or the mid portion, kind of a more diffuse area throughout the mid portion of your shin, or it can be on the back side of your calf as well. If you have a stress fracture, it's going to be painful at the beginning, but it'll get worse towards the end of your run. So on some of these long runs, it'll be very easy to tell if your pain is getting worse with running or better. If it's getting worse with running, you probably should get an x-ray and be seen. If it's worse at the beginning of your run, but it gets better towards the mid portion and towards the end of your run, that is likely shin splints, and we can modify your training regimen and get you back without having to stop your running and stop you from finishing this race. So for treatment, for a stress fracture, if you're worried about that based on what we were just describing, you want to stop running and see a physician and get an x-ray. And you probably will need to plan for a race in the future so that we don't turn this into a full-on fracture. If you have shin splints, we will want to decrease the pace and decrease the distance by 50%. You'll want to increase your low impact cross training, your biking and your swimming, because you don't want to lose your endurance, because once you get through your shin splints, you want to be able to maintain and finish your race at a high pace and a high mileage. And that helps you do that. You want to stop running on any concrete and stop your hill training. Instead, you're going to run on rubber tracks and synthetic tracks at that decreased pace and decreased distance until you can ramp up again once the pain is getting better. You want to add dynamic stretching in multiple times a day. Obviously, you're going to do this before and after your runs, but you're going to start adding this in and keeping that anterior part of your shin, that front part of your shin stretched out. And you're going to do this on your rest days as well. The most common culprit is that we need new shoes. So Regardless, it's good to always keep this in mind. You may have just gotten new shoes, so it may not be you. It may be, just the way that your foot strike is on the concrete. It may be just increasing your mileage quickly has caused this, but it's always something to keep in mind and to think about. Do I need new shoes? Am I over that 250 to 500 mile mark? And if so, let's change those out and get some new ones in there and get new shock absorption going. The last thing is, if you are flat-footed, adding orthotics can be a benefit. It can help with plantar fasciitis. It can also help with this. If your heel strike is a little bit different because of your flat foot, that can help. So it's something to consider, as well as new shoes. So just to wrap it up, going over our key points again, making sure you have a training plan that starts with low mileage and you increase it slowly, and make sure your hill training comes a little bit later. Plan those runs out to where your hills are later in your training program. Make sure that whatever plan you do use adds in those cross training days, adds in those rest days, because having those are extremely important. If you run every single day, your risk of getting one of these injuries is very high. So we want to make sure we prevent injuries rather than have to deal with injuries. Making sure to change those shoes every 250 to 500 miles, and time that change well. So you don't want to end up in a situation where we're changing the shoes the week before the race itself. We want to make sure we change those in the mid portion of your training period. And then maintain your hydration and nutrition. Make sure you add in those electrolytes. Don't forget, it's not just about water, and don't try to do that new weight loss diet right now. Last thing is, recognize the difference between being hurt and injured. That most common injury is shin splints versus a stress fracture. If you're worried about that stress fracture, come in, be seen, get an x-ray just to rule it out. Make sure that you don't need to stop running, and we don't want to end up having a worse situation than is needed. So we want to get you out there and get you to finish the race and have the best time that you can. So thank you, everybody. Good luck. If you have any questions, please call me, email me, or you can call our office if you're worried and feel like you need an x-ray too. So thank you, Heidi. And if anybody has any questions, please let me know.